Good morning. Good evening. Welcome to Sunday Night Live. I hope we're live. So far, it doesn't look like it. Yep. Doesn't look like it. Okay. All right. So we're live. Anyway, welcome to Sunday Night Live and Monday Morning Live. And glad we're all alive. Those of us that are. Great. Instagram's cool. Yeah, well, Instagram's always working. Yay. How about the other guys? Facebook's there. Yay. Good morning. April. And Kat. All right. Great. Itchy ears for a long time now. Anyway, cool. I'm glad we're able to do it, and I'm actually on time this today, which is pretty amazing. And what was I going to say? I last week, I'm sure you all know I was on Instagram, but no one else, you folks didn't realize it. So anyway, wait till a few of you get on. Okay, so a number of people are getting on. Cool. So let's do that. Let's just get going because we never have enough time to answer all the questions, right? And of course, this here is not gonna. There we go. We okay there? Yeah. Okay. So we never have time. So let's get started with them. All right. Hey, besides Facebook, anybody else on there? YouTube or anything? They all get on. X. Are you guys there? X. Let's just make sure we're all on, and then we'll get started. Are we all on? And let me see Facebook. Well, that's cool. I mean, hello. Facebook. Oh, X here. Yeah. Okay, cool. All right. Well, then that's it. Is it true? Just as like off. Is it true that best to do a parasite cleanse around the full moon? Well, if you were going to just do a short one, or a few day parasite cleanse, that would be a good time because they're hatching and all that. But remember, there's trillions of them that are unhatched. So how about several full moons? In other words, continuous. You've got to do 3 weeks on, 1 week off, or whatever, 4 weeks on, 2 weeks off, whatever. Just true. You have to keep rolling. You can't just look at it as you're going to do it in one short period of time, 4 days, 5 days, 1 week. It's not anywhere near enough. All right, so let's go on to the questions here. Yay! So we got people going. All right, excellent. Here's the questions, and here's okay. So, all right. So anyway, I wanted to get into. I just remind you a few things that you. What the hell? Already know, but then I'm gonna remind you anyway. So I think the impersonator, right, has kind of gone. I think for a while. So we don't have an. I don't know if someone's I know that I'm only on 3 places: the Inner Circle, which is a Health and Healing group, Parasite group, and the CFC group. So any other groups or any other platforms are just not me. All right, I'm on. And if you go to my drlodi.com, drlodi.com, you'll find out where I really am. Okay, because people are. I don't know why people are pretending to be me or whatever. It's bizarre. Anyway, so the 3 groups, and you should join them because they're getting they're getting. I mean, everyone's starting to get to know each other pretty well now, and there's a lot of really good support. Everyone supports each other, which is fantastic. And you know, and it's an interaction between a whole group of people. It gives you a community of people who are interested in the same areas that you are. So if it's health and healing, and you don't have any particular illnesses that you know of, or that you don't feel sick, you don't feel badly. So the health and healing group, and there's all sorts of different people on there, and with thousands of years of experience putting them all together. So it's great. And then the Parasite group, again, if you're in the Parasite group, you have automatic membership in the health and healing group, plus the extra benefits of being in the Parasite group. And again, you're going to find people that have been through what you're going through, and they we're able to help each other. And then of course I'm a part of it, so I'm answering and on the group. I'm talking about because we all have, each of these groups has a private Telegram chat group that we all communicate on 24 hours a day. So that's cool. And then of course the CFC, chronically fermenting cell group. And do I have to really explain that one again? I guess I do. Also known as the Rockefeller word cancer, but it's not. It's clear chronically fermenting cells. It is not an astrological sign inside of your body. It's just not that. Okay, so anyway, that's what I wanted to say. All right, so it's and as you all know, you can on Twitter, it's and the new TikTok, it's Dr. Thomas Lodi MD. Dr. Thomas Lodi MD. Everything else, Instagram, Facebook, YouTube, LinkedIn, Rumble, it's Dr. Thomas Lodi. No MD at the end. Yeah. So, okay. So let's get into questions. All right. And why are they so small? Oh, wow. Come on. There we go. All right, cool. So first question is, how do I get rid of frequent infections with bacterial vaginosis, then turns to yeast infection? It's a constant repetitive cycle, one after another. Okay, so this is JL. Okay, so anyway. All right, so JL, actually, this is this is an excellent question, because this question is gonna give us a view. Remember, although I want to answer questions, and I do answer questions, more importantly, I want to give you the understanding so that you could have answered the question, and that you will be able to answer later questions that will come up that you don't even know you have yet, but they'll be answered and you won't have them. So see, there you're going to be getting a benefit you'll never know about, but you will. You'll have an understanding. Okay, so let me just talk. So that's a good question. So why am I getting repeated infections? And it doesn't only have to be vaginal. It could be, you could get repeated skin infections. People get, a lot of times people get recurrent abscesses of the skin, which is usually, skin abscesses on the skin are usually staphylococcal, and yeah. So there's all kinds. You can have it in your colon, ulcerative colitis, and bleeding, rectal bleeding and mucus and stuff. But this lady's question is specifically vaginal. So bacterial vaginosis, and which becomes a yeast infection, and then I guess it goes back and forth. Okay, but so let me talk about what we need to all really start to come to appreciate with extreme, what's the word? We have to understand the enormity and the profundity of our microbiome. And our microbiome, our human microbiome, it's all of the with bacteria, funguses, archaea, and whatever viruses are. They always include them. I don't even, they don't really exist. But all right. So there's a healthy proportion of them, right? And like, so for example, in the GI tract, we have anywhere up to 1,000 different diverse species, right? And now they have about 150 times more, actually, genes than we do, right? To have an effect in biology, you need to have genes. The DNA are the ones that have the effect. Okay, now why are they there? They're there because of the same reason that any organism is anywhere. It's because it has food. It has food. If it has something to eat, it'll be there. Okay, if there's nothing to eat, it's gone. It's got to go find food, right? Pretty fundamental, primary instinct, leading to a whole set of behaviors and lifestyle is survival. Number one. Okay, first chakra. First on Maslow's list. You all know Maslow, Abraham Maslow, psychologist, the hierarchy of needs. Okay, first on his list, first on the chakras. So pretty much East and West came together on that one, and so it is fundamental, right? Second one is, as we all know, is sexuality, and then we move up from there. So, but in terms of motivations for human behavior, or in the chakra system, energy centers. Okay. So anyway, the what do you call it? So now the vaginal microbiome. So, by the way, in the reproductive system of a woman, right? We're talking about vagina, vulva, vagina, exocervix. That means the part of the cervix that's in the vagina, that's in at the posterior wall, and then that's all considered the lower part of the reproductive system. The upper part is the endocervix, which is just on the other side, not in the vagina, in the peritoneal cavity. Then the uterus, fallopian tubes, and ovaries. All right, so that's the upper part of the reproductive system, and this lower part of the reproductive system. Well, there are about 5 different minor ecosystems in there, which have differing percentages or relative proportions of these microorganisms. Okay, but you can make a big distinction between the lower part, which is cervix, vagina, and vulva, with the upper part. Okay, and that big distinction, and the main one is that in the lower part there are more lactobacillus, and the reason that's so important is because of the relationship between estrogens and all that. It's pretty. It's fantastic. I mean, to study this stuff and to learn this stuff, it's like, if how can you be an atheist? How can you say, no, there's nothing intelligent in this universe? It all just kind of exploded and then fell into place somehow. Oh, yeah. So instead of having the idiot view, sorry. Thank you, Eric. Okay, so instead of having the ridiculous view, so check this out. Check this out. The amount of estrogen not only determines the which glands inside the uterus are going to be activated the most and what they're going to produce, because they produce secretions, right, which comes out as vaginal discharge ultimately. But that changes, and any woman knows this. Every woman knows this because they know that the discharge is different throughout the month. And there's one time during the month, like probably between days 12 to 16 or whatever of the right around ovulation, that they're different, that the discharge becomes stringy. The rest of the time it breaks easily. All that has to do with the estrogen concentrations having their effect on the glands, which have an effect on the bacteria, the microorganisms. So actually, one of the things that estrogen does is for the inside the vaginal vault there, inside the vaginal vault is Please, how can you not know? Okay, so the cells that line it, the epithelial cells that line the vaginal wall, under the influence of estrogen, start accumulating glycogen. Glycogen is, as you know, is starch. Starch is starch in a plant. Would be what we, when we eat potatoes and rice, stuff like that. But starch in mammals is just and it's the same actually in plants and us, but we call it glycogen, and it's just glucose molecules strung together with alpha bonds. Okay, and we can break those alpha bonds down and produce. We can break those alpha bonds and get the glucose and get the energy from it. So that's what starch is. Okay, so in plants and in humans, but it's called glycogen. So there's a lot of glycogen that accumulates in the cells, the vaginal cells, the epithelial cells, because of the estrogen, which does what? Well, that means the lactobacilli are there because their food is glucose. So they take the glucose from the glycogen and they ferment it, right? What does that do? That keeps the pH low. All right, and the reason that's important is because see that this is how when we say that, when we have a healthy biosis, in other words, a healthy distribution of microorganisms, it's because the ones that are helping our physiology are they produce substances that keep the other guys down, and this is one of them. So the lactobacilli, which is why they're so important, is that where we go with this. Yeah. All right. So anyway, so now there's a lot more of them in the lower part with. Okay, now what do they do? What does that acid do, that low pH do? That actually keeps away and kills and doesn't allow the proliferation of organisms that we don't really like, all right, that are not in our best interest. And so also I wanted to just tell you an amazing phenomenon that blew my mind when I first learned about it, and that is that right around ovulation, what has to happen in ovulation is the estrogen has to come up, has to be, it's being produced, and it comes up to a certain point, peaks, and then it has a rapid deceleration. Well, it's that, and so when it gets up to that point, the glands the glands and the other biochemical changes that it's producing result in when the microorganisms metabolize these kinds of secretions, it's less acidic, it's more alkaline, just during that few day period during the ovulation. And the reason that's essential and mind-blowing is because when it's acidic, it kills sperm. Sperm cannot live in an acidic environment. All right. So two things happen. The sperm cannot live there, so they die. And also the mucus that's being produced, it breaks apart. If you take it between your fingers and go like that, it'll break. However, during that ovulation period, okay, they're not producing a lot of acid, and the mucus is stringy, which means the sperm can climb up, right? They're heading up there, and they aren't killed by the alkalinity. So it's kind of without a healthy vaginal biome, you could not reproduce. I don't know. That blew me away. Maybe you think that's, oh wow. So to me, it's like, what? Okay, so that's the interrelationship of nature, that we are part of this living, breathing, pulsating, enormous, endless life. We're part of it. We're part of it. Right? We're part of it. That's what indigenous people knew. Indigenous people know that they are part of this incredible We all, I don't know what we've concluded, but I know now we're pretty much cyborgs, right? I know we don't really like the natural world. We're pretty much sitting in our little boxes with all these electronic nonsense. We're gone. It's gone. We're gone. We're psychological. We're hybrid psychological mutants, and now cyborgs, mutant cyborgs, hybrid psychological mutant cyborgs. Yes, welcome to the 21st century, folks. And by the way, you know what? You don't even have to have a baby anymore. I mean, you don't have to like uh, destroy your figure or anything like that. We can extract the egg, we can extract the sperm, we can let them, and then we can let them grow into this incubator. So you don't have to worry about it. Then you have the baby, right? And you don't even have to breastfeed it, right? We've got this formula and stuff like that. Yeah, things are getting better. It's called progress. Yeah. Anyway, let's get back to this. So what happens in a healthy and so in a healthy vaginal biome, right? You're going to have predominant of lactobacillus with a pH, and then the rest of them are these other four groups, right? There's 1, 2, 3, and 4 groups, and they're dominated by different organisms, and based upon those other four groups, whichever one, and the way you can define a group is by which organism is predominating. Anyway, there are different pH levels. That's one of the fundamental end products of a biome is pH, right? One of them. Okay, so so it prevents. What does the healthy predominantly lactobacillus, which is like 92%, okay, of the organism, do? It produces an acid that prevents yeast growth, prevents multiple different bacterias and viruses, right? Right. It prevents them. Okay. So the pH varies with, from about a pH of like 4, right? Remember, neutral is 7. Our blood is 7.4, which is alkaline. So neutral is 7. Our stomach acid is like 1.5. So when we're talking about 4, that's pretty acidic. That's the healthy vaginal pH, right? It can go as high up to as like a 5.3, depending on which one of those 4 groups are predominating during it, right? Okay. So now, but this lactic acid produced in the vagina because of fermenting the glycogen, which is glucose, doesn't allow the growth of chlamydia, Neisseria gonorrhea, or trichomonas, right? What we call STDs. So one of the things that is to keep in mind, I don't know how many relationships have been destroyed because of the medical profession saying that, you've got chlamydia or not, you've got gonorrhea, it's from having sex with if you're in a relationship and you're committed to not have sex with other people, and then you have this, they go, you did it, you disloyal, you broke my heart, blah 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 blah. It's just not always the case. I mean, it could have been involved, but not necessarily. If a woman's vaginal pH changes, these guys, which are there in small amounts anyway, just like if I did a throat swab on everybody, most of us have strep. Doesn't mean we have strep. We have strep, not strep. Strep. You understand the difference, right? Yeah. It has to do with the face you make. No. Anyway, it has to do with colonization numbers. All right. So anyway, yeah. So gonorrhea, trichomonas, and chlamydia are kind of the big, what they call STDs, right? And then of course there's non-gonococcal all these terms are just nonsense. They just get you like confused, and they help with nothing. Okay. So what we call bacterial vaginosis is Gardnerella vaginalis, is the name of the microorganism, right? Okay. So basically, it is a vaginal dysbiosis, okay? And in addition to the diet, okay, so we'll talk about what contributes to that. Contraceptives, if you're taking, uh, birth control pills, hormone, any hormonal imbalances, obesity, having had a hysterectomy, because so you don't have the your upper biome, reproductive biome is changed. A lot of things can contribute to it, right? But the gut, the most important contributor to the vaginal biome is the gut microbiome. Okay. Now, what's very important in this, and this is really important this goes beyond what we're talking about. So please, everybody who's bored right now, open your ears and listen. Okay. So the gut microbiome, everyone's got a gut. All right. So if you're man or woman, if the men turned out and saying, I don't want to hear this vaginal stuff. Okay. We're talking about the gut again. Okay. We all have a gut. Okay. So what do those microorganisms do? What is one of their main jobs? They have a lot of jobs. They are why we are alive. However, one of their jobs is they metabolize estrogens. Yes, they metabolize estrogens on our behalf. And well, I'm a man. I don't. Yes, you have estrogen as well. And without estrogen, you're dead. So men have estrogens too. Okay. So they do this by anyway. They produce an enzyme, beta glucuronidase, and it is able to deconjugate estrogens. And when it deconjugates them, they can go into the bloodstream, and they have an effect on binding to estrogen receptor alpha or estrogen receptor beta. So if you have ER beta, ER positive breast CFCs, or you have prostate, excuse me, or colon or lung, all these are related to estrogens, by the way. Okay, this is profoundly affected by the gut microbiome. Okay, so it's these deconjugated, unbound estrogens that are circulating in the bloodstream that is why this happens, right? Is where we get most of our estrogens. Now, there are they call endocrine disruptor chemicals, right? And we all know those. There's ones found in nature. It's not disruptive; they change it, like the phytoestrogens of genistein and cholesterol that we get from green tea, we get from soy, and all that stuff. Okay, they modify. They are also estrogens. They're actually really helpful for us because they bind to the betas, which shrink everything down. So we like that. Okay, but then there are artificial chemicals that are used in industrial solvents and lubricants, and they are estrogen. They do the same thing, but they disrupt the microbiome. They don't allow them to do their job, right? Or they enhance, or they make them do their job at a much more rapid pace. Okay, right? And so these are the polychlorinated biphenyls and all those PCBs, right? PBBs, PCBs. Then there's the plasticizers like the phthalates. There's the pesticides, which is, we all know what the pesticides are. And then there's even antibacterials, fungicides, bisphenol A. All these things are artificial chemicals that disrupt the microbiome, so it cannot metabolize estrogen in a healthy way. The ones in nature that the phytoestrogens are helpful for us because that's why they're part of our food. They're considered part of our food. So they also help. So when we think of our body's metabolism, we're not like this separate from nature doing what we do. It's what we ingest, and it's the organism. I mean, it's a very, very complex ecosystem that extends way beyond our skin. All right. So coming down, for example, PCOS pretty much is a dysbiosis, a lower reproductive and upper reproductive system dysbiosis, and you wind up with low estrogen, high androgen ratios, and you get PCOS, right? Polycystic ovarian syndrome. That's what it is. It's basically a upper reproductive dysbiosis. Almost everything is a dysbiosis. So what I'm going to be saying to the lady who asked this question is, we need to work on your vaginal biome. All right. So the one thing you're going to do, first of all, is stop taking any of these antibiotics. Stop. Okay. You can go get some vaginal probiotics. right? And you get, or you can, you take, they give them to you orally, but also you can get them vaginally, right? And basically we're talking about lactobacilli, right? So you want to change your vaginal uh, biome, but in order to do that, you've got to have a healthy gut biome, which means you have to just do a fasting, a juice cleanse, colonics, clean yourself out, and then start eating human food, which is, sorry everybody, sorry, I know you don't want to hear this, but it's uncooked plant foods. What can I say? If you got a problem with that, you got to talk to God. And if you don't know about God, then go talk to nature. Ask nature, what the hell are you doing, man? What are you doing? I want nuggets. I gotta have nuggets. If I mean, I'm not gonna go through life without nuggets. Come on. So anyway, sorry about that. But the more you can eat of uncooked plant food, the healthier your gut biome will be. Period. And the healthier your gut biome is, the healthier you are in every respect. In every respect. Okay. So now, but especially here in this situation, so you've got to do that, and you can use vaginal. You can use you can get these uh, probiotics. Open up the capsule, get the powder, and mix it in with some water, and then put it into a higher volume of water, and actually do some, vaginal douche, and do that, and start changing your microbiome. You're not going to kill this or kill that, because as you saw, you got the uh, you get the Gardnerella, and then you kill that, and then the yeast pop up. You kill the yeast, then they pop up. That's because someone's going to take those empty parking spaces. All right, if you leave those parking spaces available, someone's going to take them. And if you don't have the ones that are on your side, then you're in trouble. Okay, so very, very important for us to understand all this. Okay, so the relationships are incredible. So you understand, we're talking about well, first of all, neurologically, the way you're thinking will affect your hypothalamus, which affects your pituitary and your ovaries and the production of estrogens. And in men, it's testosterone. And we have estrogens as well, and we have adrenal glands. So, and your level of stress, they all connect with what we're eating, and um, yeah. So what we're eating, our state of mind, uh, all of that reflects directly on what organisms are inhabiting us, in us, and on us, because they're all over. There's no place in our bodies that are sterile. Sterile meaning no organisms. They're everywhere. So, and we need them, and they're not them. We got to change that to us. All right. So everyone has to have that as your pronouns. Your pronouns are we, us. What else? Yeah, we and us. All right. So okay, we got that right. All right. So let's go back to where's that question? The questions. Come on. Questions. Is this it? No. What is this? I don't want it. I don't want it. Where's the question? Oh, how did that get there? What? It's crazy. What is all this stuff up? Oh my God. Getting closer. Come on. All right. It's the only way to do it. Questions. There we go. Got it. Okay. Questions. All right. Cool. By the way, it's April 28th, right? What day is it for you guys? It's 29, 28. Yeah. I think it's 20. I think it's 28 for us here. I don't know. You know what? Doesn't matter. Okay. So, wait, not that one. There we go. Yeah. 29th for me, 28th for you guys. I mean, yeah. Okay, so here's the question. Now, next one is, how? So that was JL. Now this is Melissa, and it's how do I get parasite meds for humans? Doctors cannot even diagnose properly. Yeah. Doctors are. Turns out doctors have nothing to do with healthcare, and you're looking for health, so that's not the place to go. Anyway, so all these anti-parasitic medications will be available soon. I know I keep saying that, but it takes a while to get this together. But we're going to have a place you can go to and get them all. So that's coming. In the meantime, if you can send attention to my assistant at hello at drlodi.com, FAH, and she can help get you some for until we get this going. But yeah, that's one way to do it. There are other ways, and lots of people. If you join our parasite group, or even our health and healing, we have, I think, but we've got a lot of resources on there of where to get all sorts of things. So that'd be very helpful too. But in the just if you want to do this right away, send that email to her, and we'll get that done. But like, for example, there's niclosam.com where you can get niclosamide from Lithuania, and then there's oh, and by the way, we talk about for humans and dogs, and it doesn't. These molecules, these chemicals are the same, and if it's for dogs, it just means that maybe they made it in some sort of paste that they like to lick, or something like that. I mean, there's no difference in the actual uh, um, medicine. There's no difference in it, right? So that's really important to keep in mind. Which is the whole Joe Tippin story, right? Remember the veterinarian told him, it was a large animal vet, said, "Hey, whenever we're treating an animal for has some sort of worms, and they happen to have CFCs, the CFCs go away." So he said, "I'll try it." All right, so it's the same thing. It worked with him, it worked with the animal. So just please keep that in mind. Okay. So that's how you get it, Melissa, for now. Okay. And then this is Sue. I had a gum infection for 18 months. Tooth was fine. I tried to fight the infection with fragile antibiotic 3 times. Fragile. And brushing with salt and peroxide to no avail. Eventually, I got facial neuralgia, trigeminal nerve pain. Yeah, that's terrible. Trigeminal neuralgia. It's very painful. I had the tooth pulled a week later. The pain was gone from my face, but I'm left with a really bad groin pain going down to my right down to my knee and along the abducted muscle. It's very painful to walk and sleep. I have a feeling it could be on the same meridian as the tooth, which was the top right molar, second from the back. I'm interested to hear if you think it could be related, the infection in the gum tooth and my leg, and what I can do about it. Sure. Okay. So I'm sure most of the people listening here understand the relationship between the teeth and the rest of the organs in the body. They're on like circuits in your house where you have the bathroom light and the bedroom light go out, and you just change that fuse and they go back on. So that's a circuit. So we have circuits in our body that go through our teeth and down to different organs. Okay, so they're related, and this is 100 billion% true. Okay, so anyway, um, excuse me. So typically, when you count teeth, you start with the upper right, go all the way back to your wisdom tooth. That would be number one, right? Well, over here to 16, then 17 to 32 on the bottom. That's typically how you count it. So with that system, number 4 and 5, and then 12 and 13, right? And then 18, 19, 30, and 31. Those are all on the large intestines, but they're also the pelvic and groin area. So they go down there. So it sounds like you had, I mean, so it definitely sounds like that's what was going on with you, definitely, right? And here's the thing: if you had, you said you had a gingivitis, a gum infection. So if you had a gum infection, that's a superficial infection. However, if the tooth, pulling the tooth relieved, that, and the neuralgia, that means that it wasn't just superficial, it was all also deep, and it was into the nerves, into it was into it got into your cranial nerves, trigeminal. This is a cranial nerve number 5. It got into there, and that's what caused the pain. Trigeminal neuralgia is very painful, but the fact that it was pulled and that went away tells us that it was a deep infection, not just superficial. All right. Now, if that was, my concern is you might have had this pulled, extracted by a regular dentist who, I'm sorry, I'm not sorry. I'm just sorry that you have to hear it. I'm not sorry for saying it, but regular dentists are as dangerous as regular doctors. They have got to. When you go to medical school or dental school and get all your training, that is the foundation, the beginning, and now you got to go learn how to really help people. Okay, you can't, because remember what happened in 1910. Abraham Flexner, brother of Simon Flexner, wrote a report got it from blah, 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 went to Congress, and then bum, 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 bum. Pretty soon we had Rockefellerian medicine, and that's what we have today, right? And includes dental as well. And the point is, these systems, not only that they have their absolute important place. I'm not. When you got to have surgery, you got to have surgery, and you don't go to an herbalist, right? Okay. When you've got, you broke your leg or your spine, or you don't. Again, you don't go to an herbalist or to or acupuncture. You've got to go to an allopathic, or shall I say allopathetic? Yeah, you have to go to one of the allopathetic physicians who, in that situation, are not pathetic. They're actually very, very cool. They're very important, very necessary, and they're helpful. Okay, neurosurgical. You got to have. You got to have it. You got to have it. You got a tumor about to compress your spine. You got to go for radiation. There's nothing else. You can't do anything else. Okay, so it's remember, we are always going to do that which is necessary at the moment and is going to cause the least harm to find our way along that path of healing. So things can get in the way, obstructions to healing, such as tumors and things like that, obstructions, they get in the way. We got to get rid of them. And if we have to use surgery, whatever we have to use to do it, we do. Otherwise, what, you die? So, okay, so you do it. But so anyway, I just really wanted to clarify that. So back to the dental, going to the regular dentist, because when they extract a tooth, they do not take out the periodontal ligament. And remember, keep in mind that muscles are connected to bones by something that are called tendons. And ligaments are the same fibrous material that connects bones to bones. Like you've got, like your upper leg and your lower leg, right, are connected by ligaments. The anterior cruciate ligament, everyone knows about ACL, which is often gets damaged during different kinds of sports. But anyway, so and we have them in our wrists and in our ankles, but we also have our tooth. So it's bone connected to the bone. So the teeth are connected to the jaw through the periodontal ligament. Okay, if you don't take that out, which they don't, mhm, if they don't take it out, then they left it in, which means there is a super highway for microorganisms, a super highway right into the jaw, and that's where they'll go. They're going to go into the jaw, set up camp, and you're going to wind up having a colony inside your jaw, producing toxins and stuff like that that the immune system can't get to because it's in the jaw. I mean, it's in the bone. You know, in the immune system you can, but it's not quite as the same as uh, in other parts of the body. It's kind of inhibited. Okay, so very very important that. So I don't know if that's what happened. I'm hoping you went to a biological dentist and they took out the tooth and they took out the periodontal ligament, and then what they would have done if they're a biological dentist is they would have then used ozonated water to clean out this, to irrigate the socket, and then they would have taken ozone gas and put that in so that it went up into the trabeculi of your bone of your jaw, and then they would have sealed it because they would have drawn your blood and spun it. And at the very top of the blood is the platelet-rich fibrin, which they would have used to seal off that area. So you would have taken the tooth out and the periodontal ligament, cleaned it, sterilized it, and sealed it. Kind of makes sense. It's called biological dentistry. I think just get rid of the bio, just call it logical dentistry. Logical makes sense, works. Okay, so you've done that. Now you've taken care of that. Okay, so if it's still affecting down here, that means that's telling you if you're having an effect on your groin or your pelvic area, and that is, and you said it goes down to your knee. So obviously they didn't do that. Obviously, you must have gone to a regular dentist. Is it dentist? Dumbest? Sorry, guys, don't get mad at me. I mean, look, I got the regular training too, and I realized it didn't work, so I went beyond that. So hey, um, yeah, if this idiot can do it, you can do it. Okay, doc. All right, doc. Um, Doctors like to be called doc. I don't quite like it myself. I hate it. Hey, doc. Oh, it's weird. Uh, Unless, of course, it's Bugs Bunny. Now, if Bugs Bunny says, "Hey, what's up, doc?" I'm cool with that. But only bugs. All right. So it sounds like you have that infection. You have that colonization of these organisms up in that area, and it wasn't sterilized and it wasn't clean. So you've got to go find yourself a biological dentist right away. You're going to make sure they're certified, not just registered or a member, certified with IAOMT, International Alliance of Oral and Medical Toxicology. I don't know. IAOMT. Okay. They train certified dentists to. Okay. You got to find them in your area. All right. And right away, and you'll take care of that. That's what's going on. Okay. Now, this is Nigel. Nigel. And the question is it safe to administer cannabis oil suppositories for an extended period of time? Are there any potentially dangerous side effects? All right, so well, yes and no. Great answer, right? Oh, thanks, doc. I waited all week for you to tell me yes or no. So here's the thing. Cannabis has it's very, very important herb in terms of helping restore balance in our systems, right? Has many, many wonderful, wonderful effects, right? I mean, it can stop nausea. It can stimulate appetite when you're not able to eat and you're malnourished. It can eliminate pain. and also help healing from CFCs and other conditions. Pretty amazing. Pretty amazing. Now, the reason we wind up using it rectally as a suppository is that um, when is that the outer 2/3 of the rectum, the veins that drain that area go directly into the systemic circulation, as opposed to the proximal or first third. So I don't know if everybody understands proximal and distal, but that's how it's referred to in anatomy, right? Something that's closer to the center is proximal. Something that is further away is distal. So the proximal 1/3 of the rectum drains through the portal circulation into the liver. The distal 2/3 drains directly into the systemic, the vena cava, right into the system. Difference is this: goes through the portal circulation, goes to the liver, it gets modulated, conjugated to become psychoactive, and you get high. All right, the outer 2/3 doesn't. And since you're going to usually take large amounts because you're trying to either eliminate pain to get off narcotics, or you're trying to just help get rid of tumors and whatever it is, you're going to take large amounts. And if that were to go all through your liver, you'd be too, even if you liked the feeling of cannabis, it'd be too much for you. You wouldn't like it. Okay. Um, Not even Cheech and Chong. No one would like it. It's like you get stupid high. I don't even like a little bit because it makes me stupid. If I just, yeah. So I haven't done it in a long time, years and years and years. But uh, it doesn't have that effect if you do it. So that's why people use it rectally. You can take large amounts and still function. That's it. Now, long term, you're saying prolonged use. I'm not sure what you mean. Like, are you talking about like 6 months, a year, beyond that? I mean, I don't think there'd be a reason to go too long. And if there is that I'm not aware of, if there's a reason, like in everything, we should never do it continuously. We need to have it breaks, because nature, the fundamental reality of nature is that it's cyclic. Nothing is continuous. It's cyclic. We have day and night, right? We have winter, spring, summer, it's cyclic. Everything is cyclic. And so anything consistently there. First of all, what it does is it has the for example, in our body, if we're doing something consistently that should be in cycles, our body becomes used to it and starts to decrease its ability to have that effect. It's called downregulation. So it'll downregulate receptors, um, and so the effect is lessened. So what is that again? Think about that. That's an adaptive response. The body's engaging in an adaptive response because its biological needs are being thwarted in some manner. What is that? It's the continuous of anything. I mean, even breathing is cyclic. I mean, we need oxygen, but we breathe in cycle. We breathe in and out, right? So, I mean, there's nothing continuous except what? Our thinking, our mind. We get a little break. We get a little break during slow wave delta sleep. We get a break, short break. So even that's a cycle. It's a big cycle, but we only get a short time, a few hours a day, if you go to sleep right. If you do proper mental sleep hygiene, but if you don't, then you're going to wind up thinking all the time. So anyway, so would there be a problem? Yes, there would be a problem. The problem is this: that you would be continuous. So whatever effect you were looking for is going to be much less than you would hope. Number one. Number two, anything in your rectum like that and it's a chemical, is going to change the microflora. It's going, because now the sus the food, the sustenance for the microorganisms has been modified. So to use it for short term, and then if you're but you're eating healthy, you're eating human food. If you're eating human food and you're doing it, okay, that's going to be the best. But for long term, to have that in there, you're going to ultimately wind up with a completely different, not completely different, but a different relative proportion of microorganisms. It's going to happen. There's no way it cannot happen. And therefore, you don't want that. So what you want to do is you want to have a healthy microorganism, a healthy microbiome, healthy microbiota. By the way, terms, again, definitions, when we say microbiome, we're talking about the DNA, the genetics of the microorganisms in your gut or wherever they are. When we're talking about microbiota, we're talking about not the DNA of the organism, but the organism, whether it's a strep or it's a candida, whatever. That's the organism. We're not talking about the DNA. So the microbiota is really what usually people are usually referring to, but it's become a habit or common to just use the word microbiome. Okay, so a microbiome that results in assisting us from, I mean, every aspect of our physiology, including our moods. I mean, there's nothing that the microbiome doesn't affect, but all of that is harmonized in perfect, beautiful, harmonic resonance with our being, with a certain relative proportion of these microorganisms. And they're there because of what they're eating. Period. 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 Big period. You know, big period. Okay. All right. That's why they're there. So is it essential that we eat certain foods if our goal is health? Yeah. And I'm assuming that our goals are health. That's our collective goal. That's why we're all here, I think, collectively. If we had one to say, why are these guys all meeting all the time? We have this thing that we're looking for, and that's called health. Anyway, I would say if you're going to, I don't know why you would need it continually for prolonged, or how long is prolonged. But if you're doing it to overcome your CFC problem or something like that, then it could be a while. But again, do it in cycles. Give yourself a couple weeks off if you can. I mean, unless you're in severe pain, do it. You have to do this according to your situation, right? And you've got to be able to judge. And remember, you don't need experts to tell you. The point is this: does it help you? Yes. Okay. Can it be a problem? Yes. Okay. How do I avoid it being a problem? Well, giving it some sort of cycles. That's how I can do that. But I've got a lot of pain. Okay, so we have to work around, figure out how to do that. Okay, but so figure it out. And there's no expert that knows. Nobody knows this stuff. I mean, they don't know it. I mean, most people don't. Well, 99.99% of doctors don't know about how to get someone off of pain narcotics by using cannabis. So you can't go to anyone and ask them about that, or if it's for whatever. All right. So anyway, what I'm saying is, be your own clinician. Be your own. Realize that you know as much as they do. You know more because it's your body. All right. Now, what's the next question? Next question is by Lynn. Lynn Duploy. Lynn Duploy. Linda. Yeah. Oh, yeah. What question is, what is the protocol for parasite cleanse? If you do not have CFCs, just to do a complete parasite cleanse, what meds do you use and how long? Okay. All right, Linda. I hope you're here today. because the what do you call it? The oh, wait, oh yeah, it's working good. Okay, okay, so you don't have CFCs, and you just want to do a parasite cleanse. So, and it sounds like, because otherwise you would have mentioned it. It sounds like you don't have any obvious manifestation of a parasite colonization, right? Because you didn't mention anything about, seeing worms in your stool or anything like that. So, so just saying, okay, I realize I'm human and I'm going to have parasites. I want to. Now, by the way, we'll never get rid of them because they're part of our ecosystem. They're in there. They're part of it. But you want to get them down into a relative manageable condition where they're not at all causing a problem. And that's how we are when we're healthy. And that requires a healthy immune system, and it requires minimizing exposure and making sure that your internal environment is not hospitable to these guys. Excuse me. So basically what are parasites? Worms and protozoa, right? Are what we call the endoparasites, right? The ones that are inside our body. Now there are ectoparasites, which are like scabies and what they call crabs, scabies, and then there are these really disgusting ones that come from like bot flies that are down around Central America and South America. And these flies, they lay eggs, and then like a mosquito or a tick or some other vector will find itself in the same place that the bot fly laid its eggs, and the eggs will get will adhere to the mosquito's legs or to the tick's leg. Then the tick comes and takes a bite out of you and leaves the eggs there, and those eggs turn into larvae. You can't be calling me. Don't call me right now. These larvae go through the skin and then migrate all throughout the body. Yeah, and they come out. Yeah, it's so they're ectoparasites. Those you would know. There would be no question, and you would have definitely mentioned that here in your question. So, but both of us are thinking about endoparasites. Like tapeworms and pinworms, and things that we're familiar with. And then we might not know it, but for example, if a woman has a fishy odor, vaginal odor is fishy, that's a usually trichomonas is the protozoa that causes that. Yeah. So anyway, so you want to take about 3 anti-worms. The word that is used medically is helminth. It's one of the stupidest words I've ever heard of, but helminth. Helminth. Yeah. It's spelled as stupidly as it sounds. Helminth. So anyway, 3 anti-helminths and 1 or 2 anti-protozoa, if you have thinking that. So the anti-helminths are ivermectin, one of the benzimidazoles, fenbendazole, mebendazole, albendazole, niclosamide, and those 3, and niclosamide, those 3 together, do it. We'll get most worms, and then 1 or 2 anti-protozoans, nitazoxanide, also called Alinea, brand name, and then what? tinidazole, cousin of metronidazole, which you might have heard. Now, what should you particularly think? If you don't have problems with your liver, you got to make sure you do a liver test, make sure your liver's fine. Then you can take, the regular doses. So what I would say to you is, Linda, is join the Parasite group. Go to drlodi.com and there's the 3 groups. Join the Parasite group. And yeah, because there might be ongoing questions that you'll have as it goes, and you'll find out where to get them and all sorts of stuff. So yeah, join, Lynn. But that's basically it. You want to get the worms and the protozoa, right? And then also you have to deal with fungus as well. The funguses. I wonder who was calling me just now, because it was a local call. I'll never know. Lisa, what are your thoughts on cryoablation? Is it safe and a good alternative to lumpectomy? Also, can this be performed on other CFC locations, such as thyroid, neck area? Thank you. All right. So, a couple of let's take a look at just the nature of the question. The nature of the question is kind of telling me that it's not necessarily, you might not be thinking this way, but usually when someone thinks, I want to get rid of this thing, is that they think that's the problem. A little mass in the breast or on the thyroid or wherever, in the lung or liver. But I'm not saying it's not a problem, but it is only that aspect of the problem that you can see. You can't see all the microscopic and smaller ones, manifestations of the same underlying condition, which is a systemic toxicity. You're not able to see that. So so you're thinking that this is the problem, and that if you remove it, then the problem is solved, and that's just not the way it is. So as long as you know that, and you know that you've really got to be dealing with this systemically by cleansing, getting rid of toxin, rebalancing, everything. There's a whole, and we all know, we've talked about it, and there's a whole process to go to begin the healing journey. But if knowing that and you still want to get rid of a particular mass, I would say, unless the mass is excruciatingly painful or about to block a vital function like breathing, eating, bowel movements, urination, or is in a place where it can't really, grow too much, like in the brain, the skull, and on the spinal cord. So we might, in those cases, have to use surgery or radiation, depending on the situation. But other than that, the actual removal of something causes it a problem. It causes it to spread, number one. Number two, it causes inflammation, which contributes to the whole process. And it diverts attention of the immune system from healing that to now healing the wound. But all that being said, cryoablation can be. So there's other ways, non-surgical ways of eliminating masses. Excuse me. So radiofrequency ablation, RFA, was done we were doing that 20 years ago. And it worked pretty nicely in the liver and stuff like that. You could just ablate it with the radio frequencies, right? EMF. And then you could get lung and liver. I don't remember ever doing it in the breast. But cryoablation is freezing it, right? And yes, it can be very effective. But like all procedures that are done, you need to always find out that the person who's going to do a procedure on you, make sure that they do this procedure frequently. And I mean at least twice a day or 10 times a week. Or why? Because regardless of their prior training and how many papers they have on the wall, it's how good they are at this now, manually. How good are you at it? And you can only be really excellent is if you do something on a regular basis, right? So when you, for example, you hear a guy sit down and play piano and you go, wow, this doesn't just do this once in a while. All right? Say anything, guitar, whatever, singing. So anything that people are good at, they do it all the time. So if you want someone to do a procedure on you, make sure that they do it all the time. And it does. For example, we used to use in the hospital, there's a PA is a physician's assistant. And PAs have had like a smaller encapsulated education that physicians have had. Just kind of like the nitty gritty, and it's not as long. So they're called PAs or physician's assistant, and they can do many things. And usually, like if they work with a cardiologist, they'll be able to do what the cardiologist does, and they'll be able to do the catheterizations and things like that with and instead of the cardiologist. And in radiology, we would have we would have someone put in a port, right? A port is where they put in. So we used to use this PA before we'd use the radiologist, who was well known, because the PA did what, 15 a day. Really, really good at it. My point is this: it doesn't matter what head of the department of whatever. It doesn't matter. What matters is, do you do this all the time? So that's what you want to find out. So the cryoablation is very important, because I've seen situations which were horrible because they did it. They weren't skilled. This is a skill. Okay. So that's what I would do. I would use that. And I would use other things too as well. If it's a lump, and yes, it can be used on thyroid. It can be used in other areas too. So, and again, and what's good about the cryoablation versus like surgery is that you don't cause you have much less inflammation. Number one. Number two, you don't really cause as much spreading. So there's a lot of good, beneficial, I think, benefits definitely over surgery. But again, think about it too. But if you just say, look, I get all that, I'm going to do all that, but I just feel better if it's gone, then then do it. Then make sure you got the right person who does these all day long, every day, very good at them, and say, what is your data? Show me what you. If you did 100 people, how many have the effect you're looking for over, like, let's say, the next 3 years, 5 years, and how many? Try to get that information from them. All right. Now, this is Lisa, and Lisa says, we hear constantly that CFCs feed on glucose and sugar. Which sugar alternative safe? Maple syrup, raw organic honey, monk. I guess you mean monk fruit. Or is it a no with active CFCs? Okay, Lisa. So this is another form of asking a question that gets asked all the time, and it's very important and worth repeating a million times. Worth repeating a million times, and that's this. Where am I? Where does that? No, no. What is that? Combination of high dose parenteral ascorbate and alpha lipoic acid failed to enhance tumor inhibitor. Jeannie Driscoll, Paul Anderson. Oh my God, we got to read that. Yeah. Okay. By the way, I'm going to talk about that. Is alpha lipoic acid and what do you call it? And vitamin C together. Okay. Anyway, so regarding sweeteners, first of all, here's the thing. Remember, we have 5 tastes. Actually, 4: salty, sour, bitter, sweet, and now they have a 5th one, which is new. They're calling it savory. I'm not sure what that means, but I think savory is a combination of 2 of the others. But anyway, fundamental tastes, right? And then most of our experience of eating is probably 80% olfactory, meaning nose, our smell, our ability to smell. All right. So, and the nose is probably the most primal sense, you know, right? You look at dogs, cats, and again, they're always smelling, and they can smell things, and that's not that they know. They don't have a database. Um, they are through the nose. They're able to detect whether to go forward or not. But the nose is very important, and taste. So taste is, but as a fundamental taste, we got salt, sour, bitter, sweet, and maybe savory. Okay. Now, interesting is that you can, for example, savory, whatever that is, if it's a combination of things or if it's an actual separate taste, if you can accent, you can shift your pleasures, your gustatory pleasures, to that away from the sweet. And in fact, in Japan, I forget the terms because it's been so many years, but in Japan there's actually, they talk about people who are, they have a name for people who like sweets versus people who like savory. Japanese, it's amazing. They're amazing. Amazing, and Japan will never stop amazing me. But anyway, so what I'm saying is that, and what I have found with working with people over the years is that if they come in and they say, okay, and they stop eating anything sweet, and they're just, and then I think within a month or 2 months, maybe, they actually don't want any sweet. They don't like it. It's crazy. I don't know. It happens. But so ideally, what I would say is, why are you, what are you, and what are we talking about with sweets? Again, so this is a big topic. So we're talking about sweets. Sweets are usually, not usually, sweets have come from carbohydrates. I mean, in nature, they're carbohydrates. And remember, the fundamental carbohydrate called a monosaccharide is glucose, fructose, galactose, right? Those are the main guys. And they form disaccharides too. They're polysaccharides, which are starch. Anyway, but they are what activate the sweet receptors, and we have a sense of taste of sweet. Now, they're necessary. Yeah. remember, we have 3 macronutrients: protein, which is really amino acids, carbohydrates, and fats. We have micronutrients, but those 3, and one of them is carbs. And carbs not only are not only there for us to extract energy from them, they also allow for the biosynthesis, for our body to make other um, uh, uh, molecules that it needs to make, right? It gets the carbon backbone from glucose. So carbohydrates are essential. So we can't say, I don't want any. You got to have them. So if you're going to have them, you want them in their natural form. When they come in their natural form, in fruit, in plants, there's carbs in plants. So there's carbs in spinach, in broccoli. I mean, yeah. And so that's it. So don't think that you're going to get away from it. I'm going to do a ketogenic diet and I'm not going to have any. You can't. If you had 0 carbs, you'd have 0 life. Okay, so you can't be without them. I just wanted to clarify, because there's a lot of, in this question is a lot of other unasked questions. All right, now, so in terms of sweeteners, right? The ones that are that have been, we've known for a long time, are the are the alcohol ones, which are well known, and then there's the other ones that are called just artificial sweeteners, like aspartame and saccharin and sucralose, but like xylitol, maltitol, lactitol, all those erythritol, they're all alcohols and an alcohol, by the way, is a molecule that is very similar, is a metabolite of carbohydrate metabolism. So that's why I don't know if you've ever heard of this, but there was excuse me, I do this like once a week. I'll just sneeze like 18 times, so excuse me. So in Japan, excuse me, there was and it happened a lot there. People would be pulled over for drunk driving, and they'd fail the breathalyzer test, and however, they didn't drink, but they just had a meal with a lot of carbs. It turns out that they had a dysbiosis of a fungal dysbiosis, and they were converting it into alcohols. All right, so I just wanted to make that point. Anyway, so alcohols and carbs, they're part of the same family, and that's why you have sweeteners that will mimic it. Okay, and then you've got the other ones, but excuse me. So what they're calling now novel sweeteners. I hate the word novel, because remember, what's his name? Fakuchi? No. What's this guy? What do you? Trust the science. Trust the science. Trust the science. The guy. He used to be head of the NIH. Yeah. Hopefully now he's being taken care of, but probably not. He's probably being pampered somewhere. He's probably living on Epstein Island. Who knows? Anyway. Anyway, they called the coronavirus a novel virus, or anyway. I hate their terms. stop already. Come on, you did. Are we at the 18 yet? Okay. So novel sweeteners are, the reason they're novel is because they're derived from natural sources. Why should that be novel? Okay, so anyway, and they call them plant-derived non-caloric sweeteners, and we all think of calories because calories gaining weight, blah blah. You got to count your calories, all that stuff. So plant-derived non-caloric. Oh, so they're from plant. They're natural. Yeah. So there's monk fruit, stevia, tagatose. But one of the latest to come to the public's attention is allulose, and allulose is like in figs and dates. It's that kind of sugar, and it has a very low glycemic response. Remember, so the glycemic index is how quickly your blood glucose goes up when you eat something. The reason that's important is because when you're talking about CFCs, is because when glucose goes up, the pancreas produces insulin, because insulin is is what keeps the glucose out of the blood and in the cells being used or being converted to fat and stored for later, right? That's the job of insulin. Well, as it turns out, CFCs have about 15, 20 times more insulin receptors. So you don't want to, you want to avoid that, because what's going to happen every time you get something that spikes like that, you have a spike of insulin, you're going to have the CFC is going to be able to eat more. So you get up in the morning and you eat something sweet, which causes your blood sugar to go up, your pancreas produces insulin, and the CFCs eat first because they have all these extra insulin receptors. They eat first, and the rest of your cells get seconds or thirds. So that's kind of the reasoning for this. However, you don't have to take that to an extreme, and understand that you also still need carbs, and that if you can keep your fasting insulin low, which is the goal, then that means that your body does not need a lot of insulin. It's very insulin sensitive, the opposite of insulin resistant, which is part of the whole diabetic thing. The more insulin sensitive you are, that means it doesn't take a lot of insulin for your cells to pick it up. Okay. So if your fasting insulin is 3 or less, you're probably very close to having the same sensitivities as CFCs. So you eat something and it's got sweet, causes insulin, but you're going to eat it about at the same time. The CFCs aren't going to get first, and you get seconds. Why is that important? Because they need 19 times more than regular cells. And if they're getting equal and you're getting equal, then for them, that's a relative starvation. Okay, so I'm going to get your fasting insulin low. What's the best way to keep your fasting insulin low? The longer the time between eating. So in other words, the longer the interval between your last meal of one day and your first meal of the next day is the best and most efficient, quickest way to lower your fasting insulin. By the way, your doctor should have measured your fasting insulin and your fasting ascorbate on day 1 and be following it. And but I'm pretty sure that they haven't. But anyway, the average eater in the Western world has probably got a fasting insulin of, 12. No. But the normal range, okay, remember, this is another reason why you don't want to be normal. The normal range goes up to like 25 or 27. Crazy. That is a fasting insulin. That means that you need so much insulin to get that glucose into your cells so that they can stay alive. that you would have like completely, that means the CFCs were just, they're like overfed. They're like, ugh. So, no, it's too cold. You see cycles. Everything cycles. I'm sneezing cycles, cold in cycles. So, the it's referred to incorrectly as intermittent fasting, which is absurd. It's not. It's eating healthfully. Eating healthfully is eating 1 meal a day, at most 2 meals a day, and within a 4-hour window. Maybe stretch it to 6 hours. That's it. Because all that time of not eating is allowing your body to clean up, reset its metabolism, get rid of waste. I mean, it's just very, very important. Okay. Which is why we have nighttime and sleep time. Because, yeah, it's real important to be, active and productive during the day, but it's equally important to go to sleep. If you don't go to sleep, you're not going to be productive. So, not eating is as important as eating. And elimination is more important than eating. I'll explain that some other day. But anyway, so allulose is really the one that's being used the most. And remember, it's a plant derived, it's normal, it's natural, and that would be the way to do it. I would suggest that you try to enjoy other flavors. Like, for example, if you eat a chia pudding, maybe you just get a coconut flavor or a cinnamon without sweet, or just by itself. And what we've lost is our ability to enjoy the flavors of foods, right? Like, people probably don't even know what a piece of lettuce or a piece of arugula or a piece of spinach tastes like anymore, because we're so used to the dressings that go with it. We don't know anymore. Do you remember? I remember as when I was young, before there was a whole thing about organic. The word didn't exist. Organic meant carbon-based chemistry, biochemistry. But I would take a bite out of an apple, of a tomato, and it was fantastic. I don't know what they taste like now, but I mean, I get the organic ones, but I don't know what the non-organic chemicals taste like. I think they just look like tomatoes, just like the apples look like apples. You take a bite, it crunches like an apple, but doesn't taste at all like an apple. That's what they have. But anyway, the tomato, so it's delicious, and we've lost that. I would love to go back like 150, 200 years and eat the food, eat the cucumbers and taste it. Just wow! Can you imagine how it tastes? So full. So we've lost that. We now combine things and we put sauces, and we don't even know what the real taste of food would be. And as my hero, Herbert M. Shelton, said, the best sauce is hunger. I love it. The best sauce is hunger. Because that with hunger, not appetite, hunger, you get salivation. Yeah, we've lost that. So one of the things we want to do is get back to appreciating different tastes, appreciating different smells, doing things consciously, eating not to, but eating, listen, I'm the worst, right? I don't know why I have teeth, because I don't even chew. I just kind of inhale my food, which is really bad. Stupid. Not bad. It's not bad. It's stupid. But anyway, I gotta chew. Anyway, that's the thing about this. But if you're going to use a sweetener, I would say you go for the allulose at this point. Monk fruit is okay. Yeah. And allulose is, I'm not sure how you buy it, but remember, it's from it's the kind of, it's the sweetness that you get from raisins and sugar, raisins and figs and things like that. All right, now where are we? So Lisa, that was that. Lizzie, when you have neck CFCs, can it quickly travel to the brain? How can I prevent it? I eat plant-based on all supplements you discuss, juicing, cleansing, intermittent fasting, biological dentist, grounding, and still it came back even though thyroid removed. Okay, so Lizzie, you mentioned biological dentist. Um, the reason I question that is because there are so many that are not. Like any group of people who do something, they're not very good at it. A lot, and they don't really know how to read the 3D cone beam CTs very as well as other people, and then their skills aren't as, So I don't know, because if you're talking about the thyroid, we're talking about, there's certain teeth that are very much related directly on that meridian. Um, and it's the same as breast, stomach, pancreas, spleen, depending on which side. But that's that, number one. Number two, um, I would go get I would, wherever you are, I'd go find Dr. Emma Abramayan in Glendale, California. Emma Abramayan in Glendale, California. And if she she says you're fine, you're fine. Um, but that's what I would do. All right. Just to make sure. If you get that out of the way, that's everything. That's everything. Now the next thing is we got to clean, continue to cleanse. Okay, because number one, number two, we either have not we've not completely eliminated the source of toxicity. Number one, or number two is the tumor microenvironment has uh, sufficiently paralyzed the immune system so that it can't do its job. So it's usually a combination of those. So how do we deal with it? We continually cleanse and recheck. Do a juice cleanse, prolonged juice cleanse. 6 weeks, 8 weeks, prolonged juice cleanse. Colonics. Go to bed early. Go to bed early. Go to bed early. That means latest 9:30. Latest. Okay. Just do it. Just do it. And then when you resume eating, you will eat only human food for a while, 9 months, as long as it takes till you get on the other side. You want to get on the other side. Okay. Now, and the reason I say that is because if you're concerned about the brain, remember the most direct route is through the teeth in the mouth. Now, just because the thyroid is here and the brain's there, it wouldn't matter. The breath it's not that much, you know. And usually whether or not a tumor, a particular location of CFCs goes to the brain has to do with the drainage systems of those tissues. So breast, go there, and lung, because of the lymphatics. Okay, and the blood vessels, but um, yeah, and other ones that go there less frequently to the brain, they do it less frequently just because of drainage patterns of all that. So that really is what has to do with it. And it's not, and don't think of because the thyroid has this close, but the breast is still not that far. The liver, lung, they're not too far. Not so it's not the distance. Okay, so but and then as far as the tumor microenvironment, first of all, I'm not sure how old you are, but if you're 40 or older, then your thymus gland is not really producing um, enough T cells, and so you should get a peptide called thymosin alpha 1. And give yourself subcutaneous injections, about 2 milligrams a day for at least 30 days, and then every other day. I didn't lose anybody, right? It just told me I'm signed out of my Zoom account because somebody else is in it. Weird. Somebody's in my Zoom account. Huh. All right. Okay, so the thymosin alpha 1, very important. So if you're 40 years old, you've already lost 70% of your thymus function. What is your thymus? It's the gland that sits underneath your chest bone here, okay, up high, right between the upper parts of your lungs, right up there. It's largest at around the age of 12 or 13. It's the most functional, like the day after birth, or maybe even in utero, when you're in the uterus. But anyway, but it starts to decline, and what happens is the actual gland gets replaced with fat, and it's called thymic involution. Until at the age of 40, it's about 70% gone. And men, it's completely gone by 65. Women a little longer. But anyway, the point is this: even at 70%, right, you need T cells. That's how you get natural killer cells. That's how you get your activated killer lymphocytes. I mean, you need that, and your T helper cells, and et cetera, et cetera, et cetera. So thymosin alpha 1. The second one you want to get is a peptide called methionine enkephalin, which is a 5 amino acid peptide. Usually, not usually, it is produced by the brain and by the sympathetic ganglia, which are little kind of nuclei of the sympathetic nervous system, which, as you probably recall, is part of you have the parasympathetic and the sympathetic, and they need to be in balance, right? So the sympathetic ganglia, and also the adrenal cortex, the outer part of the adrenal gland that produces adrenaline, cortisol, also produces this. And it has an incredible effect on your immune system. Why? Because it is part of the endogenous opiates. In other words, opiates that our body makes, right? And that's the word enkephalin. And the reason that's so important is because endogenous opiates don't only have an effect on pain, but there are opiate receptors on our immune cells, our macrophages, our T cells, and natural killer cells. All those cells, they have opiate receptors. Okay, so which again reminds us that what? It reminds us that the body is wonderfully and divinely complex and incomprehensible, right? And that you'll never have one thing in the body, one like, for example, estrogen or thyroid or any of these secretions, or this peptide or that protein. Remember, our body makes about 30,000 proteins. and our body makes about 300,000 peptides, which are small proteins. And they all have an effect, but they don't just have one effect. Like for example, estrogens don't just do this. They've got everything. They affect your coronary arteries, you know, your cerebral function. Same with the testosterone. I mean, genitalia. Uh, the effects on the genitalia of testosterone is like number 4 or 5 on the list. Number one is the brain, then the heart. I mean, the heart, then the brain, then the muscles, then the metabolism, blah, 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 and then the genitals. So it's we don't think we only think of one, usually one or two. We have to realize that there are multiple functions of almost everything everything in our body. And so one of them, the opiates. I mean, they're called endorphins because we first discovered them in relationship to opiates. And so it got that name, but that's not what it is. It does many other things. It's kind of like the BRCA gene. It's been that's the problem with names, and you've destroyed you've defined it into this little, you've encased it, imprisoned. That's not what it is. Okay, so the things that are having a wide effect, but probably the main one. So this methionine and enkephalin, its job is to mediate the neuroendocrine system and the immune system. What is the neuroendocrine system? The brain, the pineal gland, which produces epithalin, melatonin, and then so that the neuroendocrine, pituitary, which controls all the other hormones, so neuroendocrine system and the immune system, because they work together. That's why if your thyroid's not balanced, your immune system won't work. If your adrenal glands aren't working with your thyroid and they're balanced, your immune system won't work. If you don't have a thymus gland because you're older, then your immune system can't work. If your melatonin is, so all of these things we have to bring in harmonic balance, and that's what we do. We restore balance. One of them is take the thymosin alpha 1 for your situation. Number 2 is get the methionine and enkephalin, and then that what you would do. You usually get a vial of 20 milligrams, and you can reconstitute it with 1 cc sterile water, and then you use half of it in the morning, half at night. So you do that subcutaneously, and you do that again for at least a month, and then every other day, to undo the immune suppression that is caused by your the tumor microenvironment. Okay, nothing else does it. By the way, but vitamin C and all these do affect the tumor microenvironment as well. So if you're doing those plus this, it's fantastic. And then the king of them all, the queen of them all, the emperor of them all is the mind. It can change everything. No matter how great you're doing with everything, if you're in fear and angry or whatever, in trouble. It's going to shut it down. Okay, and just the opposite as well, right? You can be in trouble, but if your mind is, yeah, you can get out of that show. I just hear, which peptide did he just say? Methionine and enkephalin. Methionine and enkephalin. It's also known as MENK for short, MENK, or MET5. 5 because there's 5 amino acids. Methionine and enkephalin. So thymosin alpha 1 and methionine and enkephalin. All right, so just to follow up a little bit here. So, what my thoughts on soft tissue sarcoma in the pelvis area, parasite fungus? Oh, it's everything. You do everything all the time. Excuse me 1 second. There's somebody here. Hold on. I'm sorry about that. Um, so, soft tissue sarcomas. Listen, sarcomas, like any other carcinoma, are the same factors go into produce. What a weird little Osmo this is. Okay, good. There we go. Soft tissue sarcomas, or bony sarcomas, osteosarcomas, are the same as carcinomas. They all have the same sort of. They all have. It all is the same thing. Remember, it's still CFCs, chronically fermenting cells. The reason they're fermenting is they lost their an adequate number of mitochondria to engage in oxidative phosphorylation, so they have to ferment. So that's always, no matter where whatever tissue it starts in, it's still the same thing had to have happened. Okay, so but yeah. So yeah, we do. So for PS, so we do look at the parasites, all of that stuff, the cleansing mouth. It's always the same. So don't think it's different. They have us thinking, they have us believing that everything's different and unique, and it's not. Okay, it's not. I promise you. Okay, now this. And then my thoughts on bovine adrenals to support adrenal health, fatigue. Yeah, okay, but I prefer to stay in our species. And what I would do is this: I have an adrenal fatigue protocol that I use, and that is I replace okay, the adrenal glands produce something called hydrocortisone or cortisol. Same, hydrocortisone. They don't produce the synthetic ones like prednisone. Uh, what else? What are the other? Prednisone, dexamethasone. They don't produce those. They produce hydrocortisone, and they produce anywhere from 20 to 25 milligrams a day, just to keep our body. That's what we need for staying alive. And so, if you replace that and you give 5 milligrams of the hydrocortisone 4 times a day, then you've replaced, so the adrenal gland doesn't have to do that. And the hypothalamus is going to say, okay, we've got enough around. We don't need to make any more. However, if you do something strenuous, or you're afraid, or you got anything that calls for an adrenal response, you're still able to do it. You're not suppressing it. You're just like hormone replacement. You're just supplying what is necessary for everyday functioning, but you're not replacing it. You're not suppressing it or anything like that. So it's okay. So understand that. So you do that, and while you're doing that, you're going to make sure you have enough DHEA, because that's another hormone that the adrenal glands need, that they produce. And you want to make sure you have enough vitamin C, because that's necessary to make all these things, for the adrenal gland to make all of the products that it makes. Then you're going to do things like ashwagandha. And there are other, as you know, adaptogens, other herbs that can be used. And the reason is that I just think it's best to stay within our species, because initially with cell therapy, they were using stem cells from animals, and of course they knew that the stem cell of an animal, it's not going to turn into a human cell, but they were relying on the growth factors being produced by these stem cells and stuff like that. So it had a benefit, but there's also, you're getting there, it's not quite the same. The microflora, there are significant differences between species. And I just stay in our species, and how can we augment our species, ourselves, with plant foods and things like that. Okay, so anyway, I got to get back to these. I can't ask you. You guys got to please join the groups so that we can interact like this, because I've got to stay with the people that sent in the questions. Okay, so anyway, I hope I helped you, Lizzie, with that. with the thyroid. And by iodine, and there's so much more to do with your. Join the CFC group, please. But iodine, there's a lot of things that we need to be doing with you, Lizzie. Okay, now here's Liz. Oh, same person. Okay. You mentioned with thyroid or breast CFCs, you can put Lugol's on the area. Can we mix in poke oil or castor oil? How does it work to shrink CFCs? Also, should we be ingesting it at the same time in smoothies, etc.? Yeah. So Lizzie, you gotta join. You gotta join the CFC group. But in the meantime, I don't know what you can mix with the iodine and what you can't, because iodine is the Lugol's is um, potassium iodide and molecular iodine. All right, and what you have to you're welcome, Lupe. What you have to realize is that the here's what we don't know about chemistry. If we mix two things together, do we know if they're going to react? Okay, so usually I can assume that they will in some one way or another. And if I want to get the effects of one thing and I don't want it to be augmented, I'm going to do it alone. So I would just do that alone. So you could do the other oils if you want at another time. But I would say do this. Now, the iodine, yeah, you put that on there, because how does it work to the CFCs? Uh, it's okay, in multiple ways. But the iodine actually, the molecular iodine actually, um, it prevents it prevents the CFC from dividing. It can't continue to grow. And it's so effective that if you have enough, and then you've got the iodide part of it too, which can produce a salt bridge with a cation, with a positive charge. So a positive charge on your cell and iodide, they come together and produce a salt bridge and kind of spills its guts, kills it in that way. But the iodine is much more powerful. The iodine, and then the iodine also is a necessary cofactor in different in estrogen metabolism and things like that. So many important things. But if you have enough iodine in your body, so you've been eating it, you've replenished it. So you take 25 milligrams. The answer 25 milligrams of Lugol's tablets, or the iodoral, because they're easier to get for some reason. Iodoral is the only one that is exactly the same formula as Lugol's in tablet form. You take 25 milligrams a day. Now the maintenance dose is 12 and a half milligrams a day, and we base that on the fact that Japanese, eating a standard, typical, traditional diet, are getting about 13.8 milligrams a day. So 12 and a half would be maintenance. But if you need to fill up the deficit because you haven't been getting enough your whole life, then you would be taking 25 milligrams a day. And it takes about a year and a half. Then you can go down to 12.5 milligrams a day. Now, that what you're taking orally is for the entire body. But if you have a particular problem like breast or thyroid, and you're putting on, that's different. Still do that. Because remember, when you're doing all this too, because the iodide, the potassium iodide in there is going to, it can tell your thyroid to slow down. You've got to be measuring, you're doing your basal body temperatures and using your basal body temperatures to adjust the amount of extra thyroid medicine you'll be taking, like Thyrovance or some other Westeroid, or if you did a synthetic one, which would be like Cytomel um, and Synthroid, which is levothyroxine. So there's the